I think what's been interesting is now they actually look at some of their programs with telemedicine in mind. So for example, one client, I'm helping them do diabetic self-management, the 10-week group class. And they're like, yeah, we can do that all telemedicine. I'm like, you sure can. Now there's different dynamics in a group telemedicine class, but I think what's great is that people, yes, are seeing these things are possible. And now it helps them look at their other programs and say, oh, what can I do here? So absolutely, like you said, it's possible, and now they can work for it. I think some of the challenges that I see, and it could be also because this is really an area of expertise and something I've always been pretty obsessed with, is I really see workflows as a big thing. Because if you don't, like, if we roll out the tech, but we didn't actually have a way that we're sure the patients know how to use it, then what happens is then the doc spends 5 minutes trying to help the patient figure out how to use it, which is like a terrible use of the doctor's time. So these workflow things, and how do I make sure, has my patient confirmed the appointment? Like even sometimes appointment reminders can tell them an address to come to. Well, if it's virtual, you don't want them showing up, right? So these really, the workflows of it. And then also this idea of what can I treat how? Or if I'm doing a video visit and I need to palpate something, can I do that? Can I tell the patient to do something and that gives me enough information? And even simple things like I want to see your wound, but then the patient's like kind of holding the phone like this. It's like, no, man, turn the camera around, right? Like these are very different experiences, but if no one trained you to it, you don't know. So I think now people are using it, and I really see this next year as our time to go back and really dig in to the workflows and the clinical training so that it's as streamlined as it is in their practice when they're doing things in person.